Hello everyone, I'm Dr. Girish Nair, Chief Consultant Neurologist at Apollo Hospitals, Belapur, Navi, Mumbai. It's a great pleasure to be here today to speak to you about the one thing that has really changed our lives, the black swan event, so to speak, the COVID-19 pandemic. It's been a year and a half now that we've been reeling under the effects of this pandemic. As a neurologist, there are several aspects of this pandemic that have been very interesting, and I would like to speak upon this in two parts. I would first like to talk about the effect of the pandemic on routine neurology practice, and the second part I would like to discuss about the effects of the virus on the nervous system in the acute phase and in people who have recovered from the infection as well. One of the first observations, and this happened very early on as the pandemic sort of appeared on our borders, we found that a lot of people were putting off seeking help for the non-COVID problems. There was a widespread misconception that hospitals are not doing anything but COVID work, and we had, really worked very hard to set up an acute stroke care program. And as most people who are aware know that we act upon the FAST acronym, which is we really need to act fast when there's a stroke, when there's a facial weakness, there's arm weakness, slurred speech, and then time is of essence. Unfortunately, what happened during the initial phases of the lockdown was that a lot of patients who were aware of symptoms either disregarded them or thought that it was impossible to physically reach a hospital, or that if they reached the hospital, probably they would not get the kind of care that they were, expecting. But, that had a little bit of a negative impact on the health-seeking behavior of patients with neurological ailments, especially acute neurological ailments for which timely intervention is necessary. Fortunately, a lot of communication on the part of the hospital team that has gone out into the community has addressed this problem. So that part seems to be taken care of right now, and the numbers of patients who are seeking their regular follow-ups and emergency consultations for acute neurological problems have steadily picked up and almost gone back to pre-pandemic, figures. The second aspect of what's happening with this pandemic is the effect of the virus on the nervous system. Today, we understand that COVID-19 infection should be considered independently as a vascular risk factor. We all know that vascular risk factors, the routine ones, high blood pressure, diabetes, high cholesterol, abuse of tobacco, alcohol, etc., sedentary lifestyle, obesity, all of these vascular risk factors contribute to the stroke risk. Today we know that COVID-19 infection behaves like an independent vascular risk factor, increasing the risk for strokes, both arterial strokes and venous strokes. Of course, this is not the time to get into the nitty-gritty of how this happens, but suffice to understand that COVID-19 infection increases the risk of thrombotic events, and therefore we find that patients who already have one or more classical vascular risk factors have anything from a 3 to 4-fold higher risk of developing vascular events affecting the brain when they're infected with COVID. So we have seen this happen in the acute phase when they're infected with the COVID virus, and also when they're convalescing or recovering from the infection. So we would advise that you strictly follow the guidelines laid out by the treating COVID physician team, follow the guidelines very, very carefully, and bring to the attention of your treating physician if you're already on medication for vascular risk factors, if you've already survived a stroke or a heart attack. We're also seeing a lot of neurological problems in patients who've recovered from COVID. Interestingly, we are seeing certain autoimmune processes. Autoimmune processes are those which result from a dysregulation of the body's immune system. The body's immune system can be thought of as a watchdog. A watchdog has been conventionally trained to fend off invaders and ensure that the inhabitants of the home or the property are not affected. But when the dog goes mad, it can turn around and attack the owners. That's exactly what happens in autoimmune disorders. The body's immune system becomes dysregulated and it begins to attack the body's own tissues. And we have seen this happen after COVID-19 infection. We've seen that with conditions like Guillain-Barré syndrome, which presents with a rapidly progressing weakness of the hands and legs and affecting the face sometimes. We've seen several types of facial weakness conventionally seen related to infection with the chickenpox virus, either in the youth or childhood, but now we're seeing it after patients have been infected with the COVID-19 virus. So our understanding continues to evolve. And I'm sure in the time that this new virus that's plaguing humanity is around, we will see a lot more neurological problems delayed. We're also seeing this condition called chronic fatigue syndrome, where patients recover from the infection but report multiple symptoms like low energy, backache, forgetfulness, feeling overwhelmed, not able to sleep well, very, very commonly after we've recovered from COVID-19 infection. Now, the good news is that almost all of these can be very effectively addressed and treated if you seek help. And there are people with the expertise, with the knowledge, who can really help you emerge from, the neurological complications of COVID-19 infection, acute, chronic delay, whichever one you might be experiencing. So remember, always seek help. The neurology team is very much around, doing all routine work, all matters of emergency work, continuing with the same pace that it was, before the pandemic happened. So do not neglect your brain. It is what makes you uniquely human. Bye and take care.